Thank you for tuning in. I am going to do my Southwest Cannabis Conference presentation on Facebook Live. I do want to warn you that the content here may be a little graphic. I don't know if you are sensitive or you're sensitive to graphic photographs. If you don't want to see what breast cancer really looks like, I do not urge for you to watch this. Hopefully Facebook doesn't take it down. They might. I hope not. I have an important message, and I'll start off by introducing myself. For those of you who may watch who don't know who I am, my name is Barbara Humphreys. I am 33 years old, and when I was 31, I was diagnosed with a very aggressive form of breast cancer. So this presentation will be about that. There will be photographs involved that I've never shared before of a really difficult content, and so like I said, if you don't want to see that, then you probably should not watch this. So thank you, and I guess we'll go ahead and start, and then we can do some questions afterward. All right, here we go. All right. Hopefully y'all can hear me. Can y'all hear me all right? I'm going to zoom out so that I can get a good view of the whole screen, so bear with me. If I can hold it without shaking. Why am I shaking? All right, here we go. Alrighty. Still not far away enough. Okay. Dang it, I'm shaking still. Okay. For me, it all started with pain. My doctor said that cancer doesn't hurt. I'm here to tell you that that is a lie. The very first symptom that I experienced was pain. When I was at work and I would try to lean over the counters, I would get a shooting pain up into my chest. And, you know, when I went to the doctor, my doctor actually laughed at me. They laughed and they said, "Cancer doesn't hurt. You don't have cancer. There's no way you have cancer." Before we go into the whole thing, I just want to very quickly talk about the symptoms and signs of breast cancer, and I want to be very clear that it does affect men and women both. So men and women need to look at these signs and symptoms because it could affect you. It could affect you at any time, and so we're going to go over a few. The most common is a lump or a thickening of the breast, discharge or bleeding from the nipple, change in size or contour of your breast, any redness or pitting or any itching, inflammation, skin color changes. Does your nipple look different? Is it a different color all of a sudden? Is it pointing upward or downward? Are you feeling pain? I mean, don't let them tell you that cancer doesn't hurt, because that's a crock of shit. Personally, for myself, my symptoms were the pain, first of all. And then as I started having my examination at the doctor's office, she asked me to lift my arms up above my head. And that's when I noticed that there was like an indentation in the bottom of my breast. I had never noticed it before because I don't really typically stand in front of the mirror with my arms raised above my head. But those were the symptoms that I was experiencing. And on May 14th, 2014, I was diagnosed with stage 2 invasive ductal carcinoma, and it was 2 days after my birthday. That photo right there is a picture of my 3D mammogram, and all of the lit up area inside is cancer. It was almost taking up my whole breast. I had no idea. I'd also like to add that I was breastfeeding. My daughter was like 1 at the time, and I didn't know if the pain was from that or if, you know, so I kind of ignored it. I ignored it longer than I should have. Here's the biopsy pathology results. This is before I had surgery. They do a needle biopsy right after they suspect that you have cancer. And it said invasive ductal carcinoma. They found another kind of cancer called ductal carcinoma in situ. And then, you know, that's just a little bit of information about that. On the first day of diagnosis, so like an hour and a half after they told me I had cancer, they rushed me over to Baylor, where I met a breast surgical oncologist, and I was still reeling from learning that I had cancer. Like, I can't even tell you how my brain was at the moment. I couldn't process my thoughts. I was like a basket case. I was in disbelief. There were so many things going on. They didn't even really give me time to process it. But on the very first day, I was told that a lumpectomy was not an option, that they were going to need to remove my breast. And so I made the personal decision myself to have both of them removed. And the reason I did that, and it's a personal, and it may be vain, I don't know, but I didn't really want to walk around with one boob. I knew I couldn't afford to get reconstruction surgery, and I haven't been able to till this day. So, you know, years later, I'd be walking around with one boob, so that wasn't really an option for me. Chemotherapy was not an option. I was told that the size of my tumor was outrageous. They couldn't really believe I had a tumor that large at my age. So chemo was not an option, and I would most definitely lose my hair. I was also told that radiation would be given on top of the surgery and the chemo. Most people don't know a lot about cancer, so I'll just explain a little bit. Usually they don't do radiation after the surgery and chemo. The only reason they did it with me was because I was a very aggressive case, and I have a very high chance of it coming back. Unfortunately, it's something I have to live with every day. I just believe that I'll be cancer-free forever, but, you know, it is what it is. And I'm ER/PR HER2 positive. So what that means is my cancer is feeding off my estrogen and my progesterone. So basically, my body was literally trying to kill itself. It's, you know, ridiculous. But all of my own hormones were creating my cancer. And I overexpress a protein, which is called HER2, and it makes my cancer grow very aggressively. So that's why it got, you know, so large. It was crazy. It was the HER2 protein. Okay, they told me I would have to have surgery within the week to have a port implanted in my chest. So this photo over here, that is a chemo port, and they implanted it right there in my chest. They put a line into my artery there. Then went down into my heart, you guys. And that's how they gave me chemotherapy. I would not be able to have reconstruction until a year following completion of radiation. So, as you know, I'm like way far out a year from radiation. I still don't have breasts. One of these days, God will bless me with them, but I don't know when it will be. I know then that was one of the things that bothered me the most, but it is what it is. And I was also told that my children may be at an elevated risk for developing breast cancer. That is one of the things that just killed me until I got my genetic test. I went and luckily I got a BRCA test to see if I was a carrier, and indeed I was not. So my kids do not have an elevated risk. That's the best news. I don't know if y'all remember, but Angelina Jolie decided to have a mastectomy when she found out she was BRCA positive. That's because your chances of getting breast cancer like doubled or tripled almost. Okay, so in the first week, I met both of my oncologists. I had the surgery to implant the port in my chest, which hurt so bad. It hurt a lot worse than I thought it would. The doctor's decision was to do chemotherapy before my surgery because of the size of the tumor. It was actually 7 centimeters. And if you're not familiar with size, that's about the size of a small orange. But I was well endowed, so, you know, it was kind of hard for me to even tell it was there. I started weekly Taxol and Herceptin chemotherapy treatments. Had an MRI and a PET scan. And that's when they did the genetic testing and found out that I was negative. And here's a little slide here. It shows BRCA genetic mutations. They only take up a very small portion of most breast cancers, which is good. But if you are BRCA positive, that means that you and your family members, children, and all have an elevated risk at developing breast cancer. So this was my new reality. I had weekly chemo treatments every single week for 7 hours at a time, you guys. And that is the lovely port that they put in my chest. They would leave it in there. They would put it in there with this needle that was like the size of a roofing needle, you guys. Leave it in there for 7 hours. And here's Taxol. That was the worst drug of all. Over the time that I took the chemo, I did 6 different chemo drugs, okay? Taxol, I couldn't breathe. I mean, it gave me the worst allergic reactions. They were pumping me full of Ativan and Benadryl and all kinds of things that just really made me feel awful. Awful, awful. I hate pharmaceuticals. I would rather never take them in my whole life. And, you know, at the time, the only thing that was good were the foot rubs. He would do it for hours because, like, it was awful. Okay, so the complications. After the first chemo, as I said, you know, I started having the allergic reactions. My chemo was switched. Sorry, you guys, my phone. And this time they put me on Taxotere and Cytoxin. That is a weird little name, Cytoxin. Anyway. And my hair started falling out fast. When you lose your hair, when it starts just falling out and you rub your hand over the top of your head and you just have clumps of hair, it gets old. I mean, my pillow was covered. My hair was just, my scalp itself was killing me, so I just shaved it off. And I rocked it. I just rocked it. I didn't wear wigs. I just said, you know, whatever, because I feel like I'm just too sexy for my hair anyway. And that's just why it's not there. I think I did it well, you guys. Okay. This is a little short video of chemotherapy when they were inserting a needle in. I'll go ahead and play it. I don't have sound because I don't have speakers. I use the headset. Thank you guys for watching. I mean, I'm sure it's not the most fun thing to watch in the world, but I really feel like it should be shared. I just wanted to let everyone know that I recently, today, was asked to go speak at the Seattle Hemp Fest. So in August, I'll be going to Seattle and doing my first, like, out-of-state speaking. Thank you. So, there it is. There's a line in my chest, and that's where they put the chemo. It was horrifying. I hate needles. I still hate needles. I have medical PTSD. It's a thing. Here was the second drug, Taxotere. Okay, so after 4 months, I finished chemo, I thought. That's me and the awesome lady at Baylor. I love her. She was an angel. I need to go visit her and show her all my new hair. My mastectomy was scheduled for 11/4/2004, and that was a hard day for me because my father died on 11/3/2010. I love my dad. I miss my dad. He was my favorite person. So just having it be the day after was hard on its own right. After surgery, it was discovered my cancer had spread into my lymph nodes and had invaded my blood vessels. They found extensive lymphovascular invasion. And so they told me that I was going to have to restart chemo again, all over again, the whole thing. So I wasn't really done. This picture here was like hopes that really, at the time, weren't going to happen. I was feeling very sick and drained, and you can tell by my face there. Like, I look way different now. So after my mastectomy, I learned. This is actually a very difficult slide. So again, if you don't want to see what I'm about to show you, then you could probably just back right out of this video. After my mastectomy, I learned the real ugly truth of breast cancer. And it's not about pink, pretty ribbons, okay? It's not about walks for life. It's not about Susan G. Komen. It's not about buying t-shirts and all those frilly things. That's not what it is, okay? This is what breast cancer is, you guys. Blood drains that were hanging out of my rib cages. There were 4 of them coming out of both sides of me, you guys. That's what I looked like when I got out of the hospital. That's not an internet photo. That is the real truth. I'm sorry. Counters filled with pills. Fentanyl, morphine, hydrocodone, all kinds of things. 3 different things for nausea, amend, gabapentin for nerves. It was just a never-ending thing, you guys. That's what breast cancer really looks like. That's what I look like every day when I look in the mirror. It's just what my life is. I'm sorry If it bothers you, hopefully Facebook doesn't remove this video. But I've had people ask what it is, what it looks like. That's what it looks like. It's not a celebration. It's ugly. It's painful. And it's hard for me to talk about. It's not easy for me to do. PTSD is not just for veterans. I have a PTSD reaction when I talk about certain things, and that's one of them. That's when I learned that my cancer had spread into my lymph nodes and my blood vessels. So here is my actual after surgery biopsy. Yeah. So that mass you guys saw on my breast earlier, it wasn't one, it was 11 separate small nodules of carcinoma. I had 11. Can you count that? That's insane, and I still can't believe it to this day. I had 11 cancerous tumors in my breast. Cancer in my lymph nodes, and they removed 22 of my lymph nodes from my left side. There's lymphovascular invasion demonstrated. That's why I had to restart my chemo. And down here it says numerous small